Hi, this is Christopher Maloney, Naturopathic Doctor in Augusta, Maine. I want to talk to you about back pain. Now, back pain typically arrives at my office after people with excruciating chronic pain have been through the series of narcotics. They've gone to the orthopedic surgeon. The orthopedic surgeon has said to them, at some point, you will be bad enough that you'll want to do surgery on this and fuse your vertebrae, but not yet. So they're left with the sense that basically they can take the narcotics, which tend to have a lot of side effects for people, constipation, kind of drooling your way through the day, or they can get a surgery, which their surgeon has said, hey, you're not ready for this yet. Now we should clarify that back pain, when you look at an X-ray or MRI or CT scan, you can see some backs that look terrible. They look like they're just the Leaning Tower of Pisa has been bombed. The things are just not stacked up right. There's all kinds of internal damage looking to the vertebrae. The vertebrae are looking very worn and very unhappy. And there's other people that you look at their backs and it looks like a 6-year-old's back. It's perfectly lined up. Everything's wonderful. But in some cases, the backs that look terrible, it's an artifact. The person has not come in for back pain. And in other cases, you'll see the people with the perfect backs have this excruciating pain. So there's not a direct correlation. I'm not saying there is no correlation, but I'm saying there's not a direct correlation between what your back looks like on a CT or MRI and how much pain you're experiencing. And so when you look at that framework, within that, we expand that out. Let's say if you're in a car accident and you have 8 crushed vertebrae, you shouldn't necessarily need that surgery right away. Please don't come in and talk to me first. But if you've been told by your orthopedic surgeon that there's really nothing that they want to do right now, then let's expand that area. So you basically say, okay, so my vertebrae are bad off, or there's something happening here, but it's not bad enough for my surgeon to want to fuse me. So what's happening is the vertebrae are not stacked up correctly. And within that, then you say suddenly that there's all these muscles and ligaments around the vertebrae that have to go and stabilize that every day. So when you're stabilizing this over day after day, it's like holding your bicep tight for 24 hours straight, day after day after day. After a while, you get an enormous amount of pain in the muscle itself. There's still the functional problem, but the muscles are what's screaming. So what I do is I help train people not to fix the vertebrae necessarily. They stays where they are, but you can relax the muscles over the top, and that gives an enormous amount of pain relief. The other thing that's very interesting is that over time I've noticed that the muscles themselves have actually learned a dysfunctional framework, and so you actually have the muscles pulling the vertebrae in many cases out worse off than it would be otherwise. And so you actually can get some lessening of the vertebral displacement by having muscles relax. But the biggest thing is that people get enormous pain relief very quickly by retraining themselves to relax. And you'd say, well, shouldn't they be able to do that anyway? And my answer is no, they actually aren't. In many cases I'll say, would you please relax these muscles? And they'll go, and they'll tighten them up. It actually tightens more. They have really literally not figured out that the muscles, the relaxation response for those muscles. And so by retraining them and saying, hey, guess what, this is actually tighter than when you started, maybe we need to think something else, or maybe you just need to not do it or tighten it for me so you can kind of recenter that material in your brain so that you can actually go, okay, this is what's causing the problem. You can actually get that to go. The other thing that happens is that this tension, because it's so chronic, you can actually have overlays of other things that are causing this tension. For example, any kind of emotional stress that immediately goes to this section of the back. So in that case, there's a whole secondary layer of things I discuss with people for whom, if I'm talking to them and we're talking about their family and suddenly their back tightens up more, suddenly I say, okay, hey, let's go through that with you, not from a therapeutic standpoint, strictly from a back-centered standpoint. This is the area this is where your daughter, and she's bothering you here, and this is where this thing is. And it's just because, as you bring them up, this part of your back tightens. And that's very helpful in that case because you've got this overlay of kind of this chronic back tension plus this overlay of emotional tension on top of it. Well, the important thing is that you can take excruciating back pain and really lessen it by framing it within, okay, what is the disc, what is the disc, what is the vertebrae, what are the ligaments, what's my functional problem here, and then what is the muscle overlay on top of that. And I found that people who can really tolerate the continuing disc displacement, but they really feel much better without having muscle displacement. So This is kind of the framework I use for back pain. This is Dr. Christopher Maloney, Naturopathic Doctor in Augusta, Maine. Thank you for listening.